Hi.
We are group 14.
So,
Introduce myself. My name is Balkis Radali with metric number 175073.
My name is Noor Shaila binti Maghazali, metric number 172886.
My name is Maria Shafika Ghazali, matrix number 175227.
And I am Halisa Norde with metric number 175072.
My name is Amira Shafila binti Razali with metric number 17424.
hi, I'm Nabila Farahin, metric number 173595.
Hi, my name is Nasha Farina Muhammad Fauzi, metric number 174032.
So, what are we discussing today?
Basically, what's our aim today?
It's like we want to know.
Learn how to treat.
There's given cases, so we need to actually identify this case needs, is it radiograph, is it CT scan, or is it
We need to know how to
Fill in
fill
the
the
form.
form.
Radiograph form.
What is radiograph?
Radiograph.
X-ray.
Yes.
Okay, what is CT? How about like
CT scan.
CT scan?
Computed tomography.
computed
Yeah.
tomography?
What is it actually?
It's more like
You know radiographic is
Advanced
more
version.
2D picture, but CT scan is bony details is very clear, and also it's more like 3D version.
More expensive.
And another one is
MRI. Magnetic resonance imaging.
that is for
Soft tissue.
So,
like the brain.
yeah, for brain, spinal cord.
Okay, let's proceed to the first case.
Yeah, we have how many cases?
Okay.
It depends on
We just discuss
Just take the
everything.
the first case is Olaf, 4 months
That's
old.
my case.
Female West Highland White Terrier dog, presented with fever and inability to open mouth.
Okay. So, first,
So the key point, what is the key point?
Inability to open the mouth
Mouth.
and fever.
You can see that the animal got the maybe problem that related to the bone.
skull.
The
Maybe
mandible
cannot
or
open the mouth
around the
Yeah.
Head.
facial area.
So should we?
So what do we?
What should we take?
What part of what do?
What
What type of modalities?
Yes,
Modalities that would you choose? You would choose
I would
for this type of case.
I would
Is
choose
it
X-ray.
X-ray? Yeah. Why? Because
Which
it's
one?
what?
X-ray of the skull, and then we have standard view, which is lateral, and 3D or 3D view. Okay, so why you choose this? Because first, it's more cheaper than both than the others. Okay, so this.
Yeah. Remember, doctor said always start with X-ray.
Yeah.
So the primary complaint is actually inability to open mouth, not the fever.
With fever.
With so fever is not the real problem.
But fever we cannot see for radiograph, right?
Okay.
But
Just
yeah.
the clinical sign.
Yeah.
Maybe we can see anything.
Yeah.
What's your differential diagnosis that you can remember?
Having some this is mandibular mandibular fracture. What else? Tumor. Nothing. But the diagnosis is actually craniomandibular osteopathy. Where the osteopathy.
What is the
It's not a tumor, but the bone is proliferating.
lipid?
Yeah.
So
Classification.
Yeah, there is sclerosis of the
hardening of tissue.
the bone,
Sclerosis
the
is
bone.
hardening of the tissue.
Increasing
opacity.
yeah, not opacity, the bone
It becomes
proliferate.
like bone.
It's not hyperplastic definition. I don't know.
Let's proceed to the second case.
Yeah.
Second case is my case.
You remember what you like to do?
So the case is actually Joy, a 12 years old female muted canine.
That's my case too.
Hey, it's very old.
Yes.
Presented with 6-week history of right-sided head tilt, and hemiparesis with abnormal mentation. So the primary complaint is now is actually the right-sided head tail and also hemiparesis.
So based on the complaint, we know that this actually have
Something to do
related
with
with
Spinal cord.
the
part
nerve,
of the
yeah,
What is hemiparesis?
hemi, half part of the body is
Paralyzed.
paralyzed.
It's not paralyzed, it's weakness.
Weakness, yeah.
If paralyzed, it's another term of hemipalgia or something.
Oh,
Hemiparesis
hemi is half.
Yeah, hemi is paresis. Hemiparesis is weakness of either right or left side of the
Yeah.
body.
Paresis.
Hemipalgia is
Completely.
paralyzed of either right side or the left side. Right.
Paralyzed is all the limbs.
Paralyzed
paralysis
is
is
the weakness is just weak. So if
What is the
weakness,
difference between paralyzed and paralysis?
Paralyzed cannot move anything, cannot move your
Paralysis is just weakness.
Yeah, weakness you still can move, but you don't have the energy to move. Whereas
Okay,
you cannot.
for this case, I think we should do the MRI.
Why?
yes, MRI.
Why is it MRI?
Because paralysis, MRI,
Oh,
we
look
can
and
see
see.
the soft tissues,
Okay.
Which part of soft tissue?
spinal cord, the brain.
Yes.
Yeah, more like
But according to this
Straight.
case, this actually a very old dog. So this dog is actually prone to get vestibular disease.
it's not vestibular disease.
It's not vestibular disease.
We already-
Central. It's central vestibular disease, which actually affect the brain. No.
At first we thought it's vestibular disease because it shows vestibular syndrome like
But
because I
it's
did have to.
Huh?
But then we asked Dr. Intan, she said it's not related to otitis or
So what-
vestibular is ear, right?
But then
Which part of the
central vestibular disease, it's mean in the brain
I
that
know
control.
later on we will
Which part of the brain that control the orientation of
Cerebrum.
cerebral.
Cerebellum.
No.
Cerebrum and brain stems. Okay.
Somewhere
But
like that.
overall, for this case, we actually gonna use
MRI straight away go. Yeah.
Okay, next question.
Who's number 3? Is
Rango
Rango.
is your case, right? Rango.
Oh.
Yeah,
What is my case?
Yeah, Morenko, a 15-year-old female domestic long-hair cat with history of chronic sneezing that progressed to epistaxis.
Sorry.
Epistaxis and
Bleeding.
chronic sneezing. That
Chronic
is
sneezing until it's bleeding.
Sneeze.
Why? Because the air is
Maybe
blockade.
maybe got inflammation or something
Ah.
like that because it's chronic. So
Chronic
it's chronic.
that leads to epistaxis. You guys know right what is epistaxis?
Yeah.
Nosebleed.
Nosebleed. So for this case, we decided to take radiograph.
Why?
Send it to you.
Why radiograph?
To the scalp.
Because it
We want to
because
see
Because
inflammation
it's
around
chronic, and then she says that if it is chronic, then you might see something in the radiograph.
Okay.
Something.
Because
Analyze
it's only
the
long term, so
nasal
that means
sinus.
the
Sinus.
abnormalities
Nasal
is
sinus.
better.
The nasal cavity.
So
okay.
from the picture that are given to us, we look and we can observe the bleeding. There is bilateral symmetrical around the
Suffices.
symmetry.
Okay,
So
That's all?
radiograph.
Okay, let's proceed to case 4. This is my case. So,
No wonder you are so eager.
yeah,
Okay, let's proceed.
it's a bear max, a 4 years old.
Oh, baby.
This is paid female domestic long-haired cat was reported playing with. Let me continue this first. Okay. Was reported playing with swing kit before developing signs of hypersalivation and gagging. She vocalized and became aggressive when you attempted to move her head.
Can you repeat?
So basically, the
Key
cat
point.
accidentally inhaled some
Ingest.
something from the swing kit and
From
then
who?
swing kit. The cat's playing with swing kit and maybe accidentally quickly ingest it and then become hypersalivation and gaining. And when the owner touch her head and then she vocalize like she don't want, maybe she feel the pain. So
Do
we
you know how the cat vocalize? Howling like.
Okay, so when we see this question that we suddenly like suspect maybe due to the cat maybe ingest needle because that is the only thing from the swing kit that I think could. No, it's include the needle. Then if you because the main point here, right? The cat vocalize and become aggressive when you attempt to move the head. So it should be something problem with the head. So we suspect that we suspect it's actually we already got the radiograph and there is needle in her larynx or pharynx area around the mandible.
It crawls like this.
Yeah, it cross like this. So that's why
No wonder she's gagging.
Yeah, that's why the cat become aggressive when the owner want to move her head because it's like here is the very part. And then why we choose radiograph first? Because radiograph is cheaper compared to MRI, and then second because just imagine the cat cannot be held too long. So if we do MRI and suddenly the result is not good, so it's like waste. It's a waste of money. It's better to take radiograph.
You know how much you have to pay for MRI?
1,400.
No,
around
around 500. 1,000 is for MRI. CT scan is around 500. For X-ray is around 70 ringgit to 80 ringgit.
Wow, that's a lot of money.
Okay, what view should we take from
So for the view is the standard view, lateral, like BD. Like if you want to see like clear where the needle pointed is like DB or BD, you can see clear. It's like crossing from here to here.
From lateral to lateral.
Lateral, left lateral to right lateral. So next case.
Nice shoes.
Can you show
S3.
Come here.
S3, number 5.
S3, an 18 years old female domestic short hair cat with chronic upper respiratory disease since 2 months ago. Owner reported multiple seizures 24 hours prior to the presentation.
So what's the main problem?
Seizure and chronic upper respiratory disease.
So that means something related to upper part of the body.
Yes, what is the upper part of
Thoracic
the respiratory?
cavity.
Thoracic, skull, esophagus.
Skull, not including the lung.
Nasal cavity.
Not including the lung. Why?
Upper respiratory disease, the bronchus.
So upper respiratory is starting from bronchus,
Scissors.
starting from the trachea.
Seizure.
How upper respiratory problem relate to seizure?
Sorry, come again.
How the upper respiratory problem can
Lead to seizure?
to seizures?
Yeah,
Because this is something related to brain,
It
right?
can be related or not, either one.
So in this case,
We
it
can
could
take
be underlying disease.
So what should we?
But the name is so
But
nice, so
really-
it must got an honor.
Should we take X-ray or
from this case. We take the
focus?
X-ray
Focus.
at the skull because it
Why?
Upper respiratory or environment.
radiograph X-ray of the
MRI and radiograph.
CT and MRI.
MRI is because
Because of the seizure, I think.
MRI because of the seizure.
So
Seizure.
Because of the we can see the MRI, we can see the brain and the
Soft tissue of the brain
and also the
But
spinal cord.
I'm thinking, are you willing to pay this much for your
Or three.
No.
What's
It's
the
your
breed?
own.
What's the breed? If the breed is like
I mean,
very
it's my level.
if the
I
breed
think
is
my
like
mom will pay it.
Depends on the short hair.
Say
Yeah.
that as the doctor, we should give the best
Honor.
way to solve the problem. It depends on the owner to want to accept to the degree or not.
We must explain to them, but then
Guys, do we have any traditional
Method.
Then
solution?
if like this right, we have to take CT scan and MRI scan. So which test we should take for CT or MRI? Or
Would you like to
Just-
just you can, but if you want cheaper, just take a CT.
Since
or in this case, do
As
we
a doctors,
to
we
take
only have
both?
One lah.
So that means CT scan
do we have
first
MRI?
and then scissors.
It's
Very
rare.
you know, it's better we take for the MRI because the main seizures.
But the scissors is
procedures.
causing
Seizure.
Okay.
Next question.
Next question.
Amira, what's next?
Flynn, an 8 years old intact male boxer presented with chronic in absence, halitosis, and painful mandible.
Halitosis?
What is halitosis?
What? Sorry.
Halitosis.
I think it's the smelly mouth. Is it? Oh,
Yes,
yeah.
yes.
Oh, yeah.
Oh, tosis,
like
tosis,
ketosis.
ketosis.
Yeah, but this is hairy.
That means halitosis. If ketosis
Why
is
halitosis?
halitosis.
No lah, no.
Can you not?
Can you bring
Can you
heavy?
not?
No.
Why there is halitosis from your body?
This is what?
Inside
Boxer dog.
boxer.
Let me Google. Body.
Halitosis is the smelling.
Halitosis is the condition
Maybe
of having
to the
breath that smells
dental
bad.
organ.
Yeah.
Present order.
Yeah, just like my cat.
Yeah, it's so smelly.
So bad.
Okay.
The breath.
Okay. So what should we do?
Whose
for-
case? No one.
You want to try?
Yours?
Just keep quiet.
You want to
So
try?
what should we
What
do?
are you doing?
You can explain, Amira.
X-ray or
Can you repeat what's the primary complaint? What's the complaint?
Complaint is the painful mandible.
Painful mandible.
So we can
Problem
choose
in
the
the oral
X-ray because to
And?
see the mandible.
Probably
With the standard view, lateral, VD, and DV view.
Okay.
so I think that's all.
Oh, no need. Okay.
Okay.
that's all.
That's all from us.
Thank you.
Till we meet again.
No, you have to.
Correct.
Uh-huh.